Hello, my name's Stephen Lightfoot and I'm the chair of the NHS Sussex Integrated Care Board, and I'm absolutely delighted today to be involved with the launch of our new system-wide research strategy called Improving Lives Together Through Research. How can we use research to support our local population in Sussex? How can we improve population health? How can we reduce health inequalities? And also, how can we then make sure that we've got the best quality of care in our system? Research is going to be completely fundamental to the delivery of our strategy, Improving Lives Together. And I'm really excited to see what improvements we can make as a result of that.
If you have a healthier population, people will live longer and perhaps more importantly, live healthier for longer. So what we're aiming to do in terms of our research is to improve both quality and quantity of life. So as a member of the public, what I would say is that I would hope that you'll be able to look back in 5 or 10 years' time and say, this health and research partnership has led to increases in research in Sussex, and those increases have directly led to improvements in health.
Since about 2022, certain research active partners, the medical school, particularly University Hospital Sussex, Sussex Partnership Trust, have started to work together more strategically to think about how to harness research strength. But it's really only since about 2024, with the involvement of NHS Sussex, that we've all started to think much more clearly about how research can really be used to optimise the care that patients receive in Sussex.
Clinical research plays a huge role in how we create more understanding and provide evidence-based effective treatments to communities. By coordinating research efforts across the Sussex footprint, we can ensure that patients and communities receive options around the best evidence-based value for money care possible. There's a desire to take care pathways away from busy acute hospital trusts and more into the community and closer to patients' homes. As we do that though, we need to understand their new models of care, how effective they are, and how do we implement them in the safest and most effective way.
Research is often seen as something that's nice to have but not essential, and what we want to do is change that so research becomes a foundation of everyday practice, and it's something that people think about as part of their everyday role and not something that they do separately. Patients that are cared for in research active organisations do better. Staff involved in organisations that are research active and have a strong research culture are more satisfied with their work. Retention and recruitment is better. And we know that research active organisations overall improve the well-being of the population.
What I would really like to see in Sussex is what's called a learning health system, where we use our data that's generated in our health and care system really intelligently, in real time, to assess and evaluate how our services are working for the people of Sussex, and continually make improvements by learning from what that data is telling us. That's the kind of thing that this strategy will achieve.
I think what's exciting about the strategy is that we want to work closely with communities to kind of break down some of those barriers and challenges to research. It's really important to work with voluntary and community organisations because they are the ones that have developed trusting relationships with communities, and they can really help us to connect with them.
It's important that people from diverse communities are included in research because people from those communities often have poorer health outcomes and there's a greater health inequality. Having a research strategy means that our service users, that's people with a language need who wouldn't be able to participate in research if it was in English, can get involved and have their voices included and their experiences represented in research.
I think the strategy, one of the key things it's going to do is it's going to marry up the health needs and care needs of our local population, take that data and drive research to solve those problems and those issues we've got in our local area, in the Sussex area. And that should really result in improved outcomes for people I know, my family, my friends and the population of Sussex.